and welcome to our brand new podcast series, Decade of Excellence, Reimagining Human Health. Through this series, we'll be celebrating the 10th anniversary of our bioengineering department here at the University of Texas at Dallas. My name is Shalini Prasad, and I am the department head for the bioengineering department.
Thank you all for tuning back into this particular episode. My guest today is Kristin Tesmer. She's the Chief Executive Officer of Dallas Medical Resource. Kristin has a strong business development success in tax-exempt organizations. She's a licensed attorney with an MBA focused in healthcare management from the University of Texas at Dallas. So Dallas Medical Resource supports Dallas's prominent business leaders, health system executives, and healthcare thought leaders in their efforts to promote a healthy safety net for care in North Texas. This organization prioritizes informing and educating the community with candor, integrity, and transparency on issues impacting health and healthcare in our area. Dallas Medical Resource acknowledges the interdependency of all Dallas medical and healthcare delivery system providers in providing excellent care and service to the entire population. Thank you very much, Kristin, and joining us for this nice podcast that we have celebrating the 10th year anniversary for the Department of Bioengineering here at UT Dallas. So I wanted to start off by asking you, could you tell us a bit about yourself, your background, and your career path?
Thank you for allowing me to be with you on your 10th anniversary. It's a great time for celebration in the midst of strange times. So thank you again. Sure, I'm happy to tell you about the wandering road of my career. I actually was raised here in North Texas, and my parents still live here. My children have left. They're in Chicago and Houston, but visit frequently. I went to high school in Arlington, Texas, and then I went to the university, Texas Christian University in Fort Worth, and got a finance degree. I was very interested, though, in political science, and ended up going to law school immediately following my undergraduate work at the University of Texas at Austin. While I was there, I studied pretty much everything you could in law. I wasn't committed to a particular topic. And when I got out, I started private law practice back home in Fort Worth for a firm that did lots of different kinds of work. During those first years of practice, I fell in love with health law. It was complicated. It was very close to personal decisions, so it had the complexity that legal careers can sometimes offer to you in hard topics, along with human interaction and impact. So I pursued that with a couple other legal jobs, and then when I was working for the Tarrant County District Attorney's Office, which actually had a civil division that led all legal representation for the public hospital in Fort Worth, which is called JPS Health Network. One of the executives asked if they could hire me in-house, not as their lawyer, but as a compliance officer. So to create a program for the health system that would allow it to remain in compliance with all the myriad of regulations and rules that apply to complex systems. I thought I would do that a few years and get some really good in-house experience in a hospital and then go back to practicing law, but I never did. I stayed for 10 years. I learned how to become an operator as well as a specialist consultant to that system. And then after 10 years, I took a new position as the president of the Dallas-Fort Worth Hospital Council's Education and Research Foundation, where I could use not only my background as an attorney and my experience in community health and indigent care, but also my interest in research and education of the workforce. So we began expanding the Education and Research Foundation, and I stayed there 10 years and grew that in size along with our team. The team there was amazing and very interdisciplinary, just like the teams at JPS had been, but with a little different focus. One of the things we did at the foundation was house an enormous data asset for the North Texas region. Every hospital visit of all the hospitals here goes to a central database for analysis on population health and community health metrics. And it's been used in research for across the country for different topics, things as diverse as studies with the EPA on the worsening of asthma during high ozone alert days, to research that you all have done actually through a professor that used to be with your organization in the general school and in the engineering school, kind of an analysis of different mathematical approaches to predicting certain health outcomes. So wonderful and complex work. And then just last year, I agreed to move into a new president and CEO role of the Dallas Medical Resource. And it is a conglomerate of the CEOs of the health systems here in North Texas and the executives, usually CEOs, sometimes other executives of very large organizations here in North Texas, so Hunt Consolidated, of AT&T, Ross Pro Jr. in the Hillwood is represented on it. So there are many, Bob Rowling and many other oil and gas interests, bankers, and their job is to agree with one another on priority health policy here in the state and across the country, and present that as not only good for citizens and good for patients, but good for business. And we've been doing that. I've been doing that now for the last year and having a great time at it. I also, just in the meantime, have been teaching at UT Dallas over in the general school for healthcare regulation, and I've enjoyed that very much.
What comes to your mind when you hear UTD bioengineering?
Well, I mean, obviously, applying engineering knowledge and skills to really challenging medical problems is the core of any bioengineering group. But UTD in particular, I think UTD is very fortunate to have a bioengineering school and to be growing that school. You're positioned in a market here in Dallas that has access to unbelievable medical research at UT Southwestern especially, but from other organizations as well, Baylor Research Institute and many others. We also have a lot of workforce training things going on in Dallas, community-wide. United Way sponsors a lot of things, and so do a lot of these other organizations. I think that opportunity for partnerships with the medical field and how diverse and robust we are here in that is something I think of as an opportunity for UT Dallas Bioengineering all the time. And I also think that you have a great environment for innovation and investment from VC capital, for venture capital here in this market. McKesson is headquartered here, and as we know, McKesson has been tapped to distribute the COVID-19 vaccine for the entire country. I think there are opportunities for UT Dallas there. I know that you've been doing work in wearables, and I think of that often when I get asked about UT bioengineering. And of course, making improvements in bioimagery is a key kind of thing that should be done here. I think you've got a great start on that work, and it's a special thing that UT Dallas can shine on. So I think of those things when I'm talking with people about your program.
What are some of the greatest healthcare challenges in DFW right now?
Similarly to everywhere, the pandemic is a pretty big deal. It's upended our entire, I'm not laughing, it's not funny, it's just incredible. This is not what we planned for this year as an industry or as leaders in our field. So I would say that's certainly not just treatment of patients, which we've accelerated our learning in that really with the help of an awful lot of data analysis, but also with changes in how we use biomedical equipment and other things in hospitals. So treatment has gotten better. We're using different medications. We're positioning people different during their recovery in hospitals. And we've saved a much greater percentage of lives than we did at the beginning when these things were new to us. The additional challenge with that right now, of course, is bed availability, specifically for health systems, and provider exhaustion. People are pretty tired. Between those two items, I think that there are going to be challenges for us for the entire next year. We will hopefully be getting a bend on this by this time next year. When I say bend on this, a little more rest, a little less illness, a lot more vaccination. We're hoping that by then things are rolling along in that process. I do think that the pandemic has shown up other challenges. It's just heightened awareness of challenges we knew we had in healthcare here in this market. We have equity issues here. There are problems with healthcare access to people who are socioeconomically disadvantaged. We have some challenges in our built environment that also contribute to poor public health. I think that it's necessary to say that throughout the United States, but also here in our region, we've seen racial disparity feed into poorer health, and racial discrimination, whether systemic or individual, harm people's health, and in some parts of our country resulting in death. So we are struggling with all those issues I think as our country struggles with those issues. We have always known that from a chronic care condition sort of perspective, that we have had disparity in how populations receive care and how they live well or live less well from a health perspective. And so we definitely have a lot of need there, and Dallas County in particular has a lot of struggle. Remiss of me not to mention that our mental health and substance abuse challenges in this market are great. We're the largest city in Texas that has no state mental health hospital. We have problems still in incarcerating many people who have mental health issues, not having the ability to treat them or intervene ahead of time. We're putting in more programs for this as we receive additional funding and resources for it. But there's also a huge component of this that is a social awareness issue about how people with mental illness are very much the same as people with physical illness, and how to approach things without bias when encountering someone with mental health crisis or conditions. So I would say those are our hugest challenges right now from the broad perspective. Obviously, we have constant challenges in access to care. We have a lot of chronic illness here. We don't always live the healthiest we could in Texas. We eat too much. We don't move enough. These are all challenges. But we have great healthcare here. It's actually kept us going. Excellent providers that cover us. It's nice to be able to be dependent upon that, but it creates its own problems too.
That's very insightful of you, not summarizing all the challenges that we face here. So now looking ahead, right? So you work and see a wide variety of individuals and professions that make up the healthcare industry. So besides doctors and nurses, what are some of the careers one can pursue within the healthcare industry?
I am so grateful you're asking this question. Most people who think of healthcare do think of doctors and nurses. And while there certainly are many of those, and we need many, it's amazing the diversity of roles that one plays in healthcare. I'd like to be very specific about ways you can enter into the healthcare field and contribute to these efforts in society with your own expertise. First off, there's a huge effort in healthcare, and there has been for many years, to be interdisciplinary and people-focused in our healthcare delivery. We had been a whole industry of specialists for a long, long time. And now the most complex problems in healthcare are really the only ones that are left. The simple problems are done, and complex problems require interdisciplinary teams. So we have not only doctors and nurses making decisions, but they partner with the rest of our teams. That includes, you can think of us like a business. We're huge businesses, 45,000 employees, 25,000 employees, those kind of things, just depending on which system you're talking about. They have human resource and business finance people all over the place. So it's like any other business in that respect, and people forget. That's an enormous part of the populace of workforce in the healthcare industry. There are, of course, a huge need for medical device technicians, laboratory techs, radiology technicians. Pharmacology has its own set of experts and team members. We have an ever-growing number of information technology experts and support teams that work with our health systems as employees, not just as contractors. And then we have a heightened focus right now that we maybe had let slip a little bit. You heard in the news, we have supply chain experts that we need. And these are, not just supply chain experts to order the things you need and to make things flow inside a health system. It means interacting with the other industries that provide pharmaceuticals and PPE and technology assets and everything to such a complex system. The reason we have hospitals and health systems is because we always need to be able to treat traumatic incident. There's an enormous capital and infrastructure investment in these facilities because they're center points for things that are complex, all right, that you can't get somewhere else, and you want to minimize costs by putting them making the investment and upgrades in one place. And then you also have the opportunity to put a lot of specialties together that you can't get in a doctor's office or a smaller place. It's just a huge effort to address complex issues for humans. So that just means lots of different types of professionals and workers. And you can't forget people that clean the buildings and build the buildings and feed everyone. We have enormous groups of chefs and cooks and food servers and patient transport people and drivers for stuff all over the place. It's a lot of business function as well as the medical things that you think of. There are whole engineering sections of health systems they're all engineers of different types that when a place is large enough, instead of contracting it in, they'll hire on-site teams to do all this work 24/7. That's the other thing I always let people know. It's not working in a health system is not a day job. So you're always on call. There's always things that come up, and you're important enough on a team. If you get called in the middle of the night, you go because people's lives depend on it.
That is actually a very nice overview of all the various things that people could do in terms of engaging with the health industry. So this brings me to a very important and topical point for us. So how do biomedical engineers fit into the broader healthcare industry?
One of the things I love about educational experience and training of bioengineers is that they are taking problems that providers identify in healthcare settings, and they really translate them into innovations that are going to accelerate healing, save people's lives, avoid pain, provide more comfort, and really even prevent disease. So to me, bioengineering, because we're for the most part an evidence-based industry. We're a conservative evidence-based industry. We need a lot of proof and a lot of expertise fit into things to trust solutions when you come to these important decisions for people's health and lives. I think that bioengineers are trained for that. They're detail-oriented. They are fixers. I love that. Obviously, they have an interest in complex problems like the human being. Not that all human beings are problems, but they have complex problems. And so that makes them curious. I'll give some examples. And one of my favorite examples is actually something that happened with my daughter. So I'll take it to you. She is now in her master's program at the University of Texas at Houston in public health epidemiology. She's finishing up this year. Prior to that, she went to Rice University in Houston. As part of her studies, she participated with a group called the Rice 360 Institute, which goes overseas, assists with people's health concerns in foreign countries, has experiences for students to travel and do that sort of thing over there. She entered into a program. Her degree was in neurosciences and psychology. And so she became the human factors expert on a team with engineers who use 3D printers to create solar-powered wearable temperature monitors for pregnant women in Malawi. Okay, so these engineers saw this problem. They had actually, the scientists brought it from the medical field. These are doctors out in Malawi. Women there are mostly rural and don't have much access to healthcare, and they would lose babies often because of illness. And what they wanted to do was have something that they could have a woman wear and be powered without battery, so it could be worn, and survive in the conditions in which they lived, and that they would wear. That's where Georgia came in, something that wouldn't look like a bomb on your arm or something that an engineer might not always think through all the human factors. So she was part of this interdisciplinary team. These are things that saved women's children across the world. So I think of bioengineers as integral to improving basic health functions, cleaning water in other places. I mean, working with the Gates Foundation, a bioengineer could easily go into the field and be working to save people, not in the United States where we have solved many of these problems. Flint, Michigan, we have pretty good water here. But I mean, these are these are fundamental problems for the entirety of the world and in many places. So participating in things like that, I think of bioengineering as a huge fit. Now that's way out here. In here, bioengineers can be part of teams that deal with genomic analyses and the making of new drugs and new pharmacological interventions, but other interventions as well in disease. Obviously, part of teams for vaccine distribution, which people are pretty excited about right now. You can be part of teams that create new limbs and better limbs for veterans who lose them in war or people who lose them in accidents. Basically, you're looking as bioengineers, I think, for efficiencies that can improve people's lives at a lower cost. There's always a cost at the adoption of innovations that you might make as an engineer. But post-innovation cost, these are things of more access, more accuracy in how we treat people, lower societal cost, increased benefit to society as a whole. Those are complex. There are other ones. If you're more into technology, you can be a part of the telehealth revolution. We're continuing to improve that and everyone loves it. Analytic work on large populations, AI we're generating for better healthcare decisions. You can be part of all of that, not just in making devices, but in how you collect data from those devices and things that we need to continue our improvement. And then I'll just get as simple as possible. We really need people who can help us devise testing kits and reagent kits as we go out into the field with pandemics like this. And this won't be the last pandemic, guys. I don't know if it'll be another 100 years till we get one like this, but they keep coming. We have assets for this. We're hearing that one of the vaccines that may be available to us for COVID is needing to be kept at -70°C. We need some engineers to help us with that, because you know what? Nobody's real good at keeping things at -70°C, and we still need the stuff out there. So how are we going to do that, guys? That's where we need bioengineers. I can promise you a doctor can't figure that out. So
thank you for those great examples and a good vision for where bioengineers would fit in the larger spectrum of the healthcare industry. So just kind of following up on that, biomedical engineering awards degrees at the bachelor's, master's, and doctoral levels. So how do the opportunities and roles in healthcare change with these various degrees?
This is a really good question. I mean, you're basically looking at what level of education do you need to do the things that interest you. So first off, a bachelor's degree in engineering, I mean, obviously you have to get these iteratively. So you need one if you ever want to be a PhD. So, but when you have your bachelor's degree, that's a very good degree to go in and actually be feet on the ground in a health system. As I mentioned, working in medical device calibration, maintenance, management. You're going to be feeding data to other people about the function of these things and about how they work and ensuring their reliability in a health system, which is key. I'm sorry, it's just key to getting answers right. If you're an evidence-based model for determining how to proceed with someone's care, the machines that monitor what that is have to work, and they have to work really well. So I would say that's a great starting level. As you progress, if you're a master's degree, I think a master's degree person, in my opinion, you've got more experience and practice as well as education at that point in interdisciplinary problem solving. You're going to have the ability to be more in a management position and oversee other engineering aspects of an organization, and you'll probably be expected to play a leadership role in change management and things of this nature that are in a health system that require everyone on board from all the different disciplines as you move people into new models of care based on the science and technology available. PhDs, I mean, obviously you can continue to do that, and if you're a doctor bioengineer, you have the added bonus of being able to do research, publications, you can teach. And to me, that's not everybody wants to do those things, but if you want to do those things, that's what you need to have access to all of the opportunities that you might want, whether that be through NSF grants or NIH type grants or any of that sort of thing. So to me, of course, I'm a big advocate for education. So I have some, and I have lots of friends who do, and I teach when I can. And both my parents were professors, and my grandfather's. So I mean, we are into you educating yourself, if for no other reason, so that you benefit from the knowledge and can have a broader perspective of the world. But from a purely what can you do with it, if you want to do research helping in genomics and development of pharma, you're going to need at least a master's. You can be a person who helps in the lab with a bachelor's, but you're not going to be running that project. So to me, it kind of depends on how you feel as you go through your life about your contribution, how comfortable you are with the role you get to play. I always do tell people, if you're in doubt, go ahead and try to get more education early, because later in life it gets hard sometimes to go back. So if you can afford it and if you're really interested, it's always good to start and keep going. That's my mind. I also think that, if you're looking at doing things like having patentable work and stuff like that, anyone obviously can do that at any educational level or no educational level at all. Just look at the guys like Steve Jobs who don't finish college and it's just how it is. But it does help you get venture capital when you have a certain educational level. If you're looking for innovative financial support and things like that, sometimes having a higher educational level can assist you in that regard. People are willing to take a little more risk when you're a little more experienced and have a little more education. That's what I think.
Finally, looking into the future, what are some of the greatest needs within the healthcare industry?
Thank you for asking. First off, healthcare, you should know, is an industry that believes it needs help. So you will be welcomed as a problem solver, especially one with scientific background. Sometimes healthcare people get frustrated with policy because it's not based in science, but they are rarely frustrated with science. In fact, they're usually fascinated and want to learn more from you. It's a feedback loop that's very positive. So if you're looking for an environment like that, we need your expertise. And I can assure you there are not people who are well trained in medicine. There are very few that have any good training in engineering. That is just not. So they see you as part of the scientific team saving people. For biomed in particular, I'm just going to say it, we need interdisciplinarily trained and experienced practiced engineers. So we have been doing, but it's still at the beginning compared to the overall training of medical professionals. We are now invested in the training of interdisciplinary medical professionals, expecting team problem solving. We feel this is really a key, as I said before, to solving complex problems. I think that biomed can help us by involving themselves in this. I don't think sometimes medical professionals are not the most creative thinkers when it comes to new and innovative. As I said, we're a conservative group. So we would love to hear about these solutions, but generating the new ideas for what those solutions could be, we probably don't have the background we need to know the possibilities, And so that, as a well-trained biomedical engineer, you offering up things that people don't even understand might be possible, huge part of the team. So you want to help us not only be good at what you do, really good at what you do, study hard, but think creatively and practice communicating with other people about your ideas. I realize those are soft skills compared to the complex mathematics and other things that you are working on, but you want us to adopt. And if you do, then those are important things you can do for a very people-focused, in some ways, audience. I always encourage anyone, because of my own background, if you have a chance to learn anything about how business runs, about how things are funded, it's a really good idea to know that. Not just for grant work, if you're really highly educated and looking for that, but also just for how a business works, so that you understand that how to assess what resources you may need and where they may come from, or to at least know to find friends and ask the right questions so they can find it for you. That's what I mean kind of by interdisciplinary work together. And then I would say this, stick with us. Our environments are not the same as a lot of places other engineers go. My dad is a PhD aerospace engineer, retired now. Some of the stories I tell him about how things happen in a health system environment, he just can't believe it, And there's not the same level of high reliability, although we try to adopt that as a theory. It is not embedded in our work the same way it is in yours. And we want it to be. You can help us with that, but we also have cultural problems with this. And so as a biomed person, you can help us with those emotional challenges we have to changing, some of our independence of how we approach treating patients and things like that, and give us more logically derived and more technically advanced and more reliable solutions. So we need that a lot, and all of you could do that from BS degree into PhD level. So I want to tell you how grateful I am for anyone listening to this that's studying bioengineering. Just keep coming. We need you.
Thank you so much, Kristin, for first taking the time to chat with me, and second, sharing your thoughts, your experiences, your vision for what the healthcare industry needs in the terms of bioengineers and how we may contribute to the greater good of society. So thank you, first of all, for being a friend of bioengineering here at UTD. And we look upon you, your experience, and your leadership as we evolve and grow our program to be truly impactful to the DFW community.
It's always
Thank you very much.
it's a joy to serve with you. Thank you very much.